Hi, I'm Cayce. Welcome back. We are joined today with Dr. Janna Bentley from Lakeshore Vein and Aesthetics, and today we are going to speak about the benefits of laser to treat sun damage.
Yes.
All right. So, we live in the Okanagan Valley and we all get a little bit too much sun at times.
Yes.
How does laser benefit someone who has sun damage?
To be very clear, we're talking cosmetic here. We're not talking about preventing skin cancer.
Correct.
So if you're talking about pigment, we discussed IPL earlier, so that's going to help with brown spots. Those are sun damage. You can also get little red blood vessels that will also be helped with IPL, or that other laser you were referencing, the pulse dye laser or the V-beam, will help with the redness. And then we have wrinkles. And so resurfacing is something that really helps with that. And basically with that particular laser, it's a controlled burn to try and stimulate cell turnover and to take off the outer layers that are damaged and allow new cells to come through. So it can help with fine lines and texture.
Okay. So the difference being is one is light therapy and one is laser, correct?
Yes, and the target with the laser for resurfacing, so it would usually be a carbon dioxide or CO2 laser or an erbium. They're the stronger lasers. Their target is water.
Okay.
So and we're 80% water, so
Right.
it's a controlled burn. And these days we have fractionated lasers. So what that means, instead of having every bit of skin underneath the applicator being targeted, it's fractionated, so it's more like aerating a lawn, where it's little tiny, not holes, but you're not treating that whole area, you're treating sort of a dot pattern, and so you get the results that you would have from the full area being treated, but you have sort of islands of treated skin with untreated skin, and so you heal a lot faster and much less downtime.
All right. So how often would you need, if you do have sun damage on the face, how often, or if you are treating wrinkles, how often do you have to, like, how many treatments would you need?
Well, often it's just one.
Oh, okay.
If you're targeting sun damage. If you're treating acne scarring, which is another topic, it's a different.
And that's a big one.
It's a different pattern or protocol. But with sun damage, it really depends on how invested you are in sunscreen and skincare, because if you're doing all that, you're going to heal faster and need it less often because you're doing the
preventative.
You're doing the work.
Correct. Yeah.
With the skincare.
And we are going into Cancer Awareness Month. Let's talk about that sunscreen. Because it lends to both in order to prevent the treatment. What's the important? I mean, we all know the importance of sunscreen, but is there a difference in sunscreens?
Yes. So first of all, the sun protective factor, the SPF. Do you know anything about that number? Like, what number do you think is a good number to use? I
typically use 50.
I was going to say, on you or your kids? What number?
Exactly. On me, for my children, I'm getting to the 45 mark. But for myself, definitely 50. Honestly, I feel like I should be bumping it up to like 220 at this.
And obviously, by what you're saying, you realize that the higher the number, the stronger protection. The stronger
the protection, yes.
So what that number means, if you're using an SPF 30, you're allowing a 30th or 1/30 amount of burning radiation through to your skin.
Okay.
So the higher the number, the less burning radiation is getting through to your skin.
So obviously the higher is going to be better.
Stronger, yeah.
Stronger.
And then you've probably heard about physical or chemical sunscreens. And nobody wants to look like they've got zinc all over, but zinc and titanium are they're the types of sunscreens that are physical, so they're actually sitting there deflecting the rays.
Right.
And those ones tend to be more waterproof.
Okay.
So if you go swimming,
which is important,
or if you're sweating and you're out golfing, that kind of thing. But you can get good quality ones that don't look pasty white.
Right.
That can be rubbed in well. And then there's the chemical screens, and they actually absorb the radiation, preventing the skin from burning.
Right.
And you do need to reapply, because with the physical blocks, you're going to sweat them off or swim them off in the water. And then the chemical screens have sort of a lifespan of how long they're actually working, absorbing. And so you do want to reapply every 2 hours or after going swimming.
Okay. Back to laser treatment. Can it treat any part of the body? Like if you are looking to treat a brown spot from sun damage, hands, face, neck, chest, anything? Legs?
Yes. And again, I've never done legs as far as the wrinkles and that go.
Right,
but
of course.
Targeting pigment.
Yes.
You just need a technician who knows what they're doing, because you don't use the same settings on a face as you would on a chest, on legs,
Okay.
hands.
Okay. It is quite amazing, isn't it? That we can reverse,
Yes.
the fun times
Yes,
that
exactly.
we've had.
Yes.
Is there anything else that you can lend or say that I haven't asked you regarding laser and the importance of it, or the more benefits, I suppose?
One thing that is important to get the best results, I was alluding to it before, is also, besides sunscreen, there's the ABCs basically. Everybody should be using a retin-A for skincare. So topical vitamin A, it helps with free radical damage, which is something that ages our skin and also does lead to mutations, which would become cancer.
Right.
And then you want a broad-based sunscreen.
Right.
So the B. And then the C would be a topical vitamin C.
Okay.
So
all of which you carry
Yes.
at the clinic. Now,
Yes.
is there a certain the skincare world is so vast, and there's so many products out there. How do you define, or what do you look for in order to know that you're getting the best bang for your buck, I suppose?
the big difference is pharmaceutical grade versus what you can buy at the Bay.
Right.
So if you're getting it or from shoppers,
Right.
if you're somebody who's investing in skincare, you're going to Sephora, that kind of thing. Already, if it's not pharmaceutical grade, the restrictions on what they can say are far less. And so if they say 99% more powerful than it used to be, but you don't know what 99% of what.
Right.
Whereas pharmaceutical grade, they have gone through more rigorous studies, and so they have the data behind them, and they can't make claims that, so they're going to work better. So, and I would say that price-wise, they're similar to the higher-end skincare that you might buy at the Bay or at Shoppers, and so you might as well be getting stuff that has more behind it as far as science.
Yes, more science and exactly more standards. I think as well. There's more a different standard.
They're held to a higher standard.
Yes, and I believe that is the same with sunscreen as well.
Yes.
And it is, especially when you live in a destination as we do. As you said, I think that is the key to also aging is preventative.
Yes. And
there are some great quality sunscreens that I know are definitely supplied or sold at clinics as such as yours.
Yeah, exactly.
All right. Well, I believe that should conclude this episode of Be the Best Version of You with Dr. Janna Bentley, as always. So good to talk to you. And thank you.
Yeah, thank you.
Perfect.